Okay, so we're almost, everybody has one. We'll go ahead and start. So we kind of switched some things around today at the last moment, so apologize if you came in earlier for the talk. With me and Dr. Warren switched on the Miracle Mouthwash. He had to take off at this time, so we just did a little switcheroo. So my name is Mike Gallagher. Some of you know me, some of you might not. Is anybody here for the first time? You are? Okay, welcome. So we have these wellness events every couple months, so welcome. We have free food, free literature, free samples. Feel free to help yourself on all those items. Just a little background on myself real quick. I'm a certified lifestyle educator. I've been in the nutritional industry almost 20 years. So there isn't too many questions I haven't heard of that we can't help you with nutritionally. So again, I'm actually only here during the wellness weeks. Normally I drive around to different healthcare offices, practitioners, and just show them the research about these nutrients. And when we put it all together, combine with proper diet, proper lifestyle, stress reduction, exercising, we can have some miraculous events, miraculous moments. So, if there's any other questions about any other topics, please come see me after we're done. We'll be glad to help you out. If I don't know the answer, we'll find out the answer for you. I'll talk to Dr. Wine or someone else that might be able to help you, but there aren't too many questions I haven't heard before on that. So today, Doc wanted me to speak a little bit about vision. Okay, this is one of the most common questions that we get asked during these wellness events. By the way, we have these events again every 2 months, so the next one will be after Thanksgiving, that weekend, November 29th to December 6th. So please mark that on the calendars. Hopefully you can join us then as well. But Doc wanted me to talk about vision. And we actually are debuting a new formula for vision called 2020, okay? So we'll be talking about that. But again, the thing that we want to emphasize with vision, you know, we can help slow down the process of vision issues. But the more serious eye issues, you know, again, and depending on where you're at in the spectrum of how long you've had this issue, again, we can't turn back the clock. And if we're talking major issues like cataracts and macular degeneration, we're not going to cure it, but we can dramatically slow down the progression of it, like slow it down. So that's how we would phrase it, and that's where you have to have realistic expectations as well. But the earlier that we are using these supplements or using the right formulas, the better off it will be. So we do want to emphasize that first and foremost. Okay? So let's talk a little bit about our formulas in our line, Nutritional Frontiers. And these would be some of the major ones, and we'll break these down here in a moment, starting with this new 2020 herbal tincture. Fish oil absolutely plays a role in so many different benefits, but your eyes especially. Pro Reds, which are a fruit and veggie drink, and astaxanthin, which is also relatively new for us as well. We'll talk about that and how that fits in. So you can do any of these or all of them depending on severity of your eye issues. Okay, so we'll talk about exactly how they all fit in here in a moment. But if I were to just do one thing for the eyes, if your budget only allows for one thing, it would be this new 2020 formula. So this is an herbal tincture. Okay, so this is in our herbal tincture line, which is in the far left corner of the clinic. So we have a lot of different tinctures available, but this is our newest addition for the eyes. So if you've never done an herbal tincture before, typically the way we dose this is 2 droppers full. You fill it up all the way in the morning with a glass of water or tea or iced tea or green tea or juice. Okay? because these are alcohol-based. These are alcohol-based. We use the alcohol as a preservative. So the more liquid you add just to dilute the alcohol dose, okay, the alcohol flavor. So 2 droppers full in the morning and 2 in the evening would be for major eye issues. If we're just talking preventative, it would just be 1, we cut that dosage in half. Basically 1 dropper in the morning, 1 in the evening, okay? It does come down a little bit when you fill it up. It comes down about 3/4 full, okay? And if you're doing 2 droppers, people always ask how long these last. If you're doing 2 droppers twice a day, this typically lasts about 2 to 3 weeks. So you want to factor that into the equation as well, okay? But this would be the #1 supplement that we have now in our line at Nutritional Frontiers, Dr. Weiner's line. So we can see the different herbs that are in this. And we'll break all these down here in a moment. Right here, so eyebright is actually an herb, white pond lily, ginkgo biloba, horsetail, bilberry, passion flower, some of the flowers, plantain, and lycium. So all of these actually have research. A lot of these herbs have been used for centuries for eye benefits. Also goji, missed that one too. All of these will help in one way, shape, or form for strengthening the eyes, okay? And a lot of these you can buy individually. But again, our philosophy at Nutritional Frontiers, Dr. Weiner's line, is that we're trying to combine maximum ingredients. Combination, when you combine multiple ingredients, they work better than buying them individually and using them individually, okay? We call this synergism. And again, would you rather take 10 different supplements or 1 supplement? I'd rather take 1. Most people would rather take 1, right? And that's what we're trying to do, get you the best bang for buck there, the maximum benefit of a formula. Okay, so let's break some of these ingredients down just to give you a little more background on them. So eyebright, again, semi-parasitic on grasses and other plants. Okay, it is called eyebright because it has been used for centuries for exactly that benefit, treating eye infections. Okay, also helps with swelling, redness, any type of disturbance. So if that is you. Also eye strain has been also helpful as well. Ginkgo acts as more blood flow, more circulation. So some eye issues are related to this. So that's where ginkgo comes into the benefit there, and also has some antioxidant properties to it. Horsetail actually helps support good calcium metabolism in the eye, as well as the whole body. And bilberry on its own has been shown to help, especially night vision. There's research on that as well. Goji, this is more your B2, great source of B2, which is known as riboflavin, very beneficial for vision. Passion flower, again, goes back centuries as well for vision and eye function. Again, the flower family, again, dry eyes. So we get asked that question a lot. Do you have anything for dry eyes? Yeah, that's where this ingredient would fit into the picture. Plantain for infections. And again, the lycium fruit there. Again, failing eyesight. So again, both near and far sightness, general eye weakness, and assists in circulation. So again, this is a really powerful combination. There's no other supplement formula that we've seen that has this combination of these different ingredients in them all at once. So this is very, very, very powerful. The second major formula that we would recommend for eyes is this one, astaxanthin. So this is a very long sounding name, but this is an antioxidant that comes from the carotenoid family, your carrot family, okay? So we all know that carrots are good for your eyes, but you would have to consume 6,000 carrots to equal 1 dropper of this. So that's a lot of carrots, okay? So I'm just going to pass that around. Now, the way we dose this, before I get to that, the way we would dose this for major eye issues, so cataracts, macular degeneration, would be 2 droppers full. 2 droppers full. In this one, we're shooting this right into your mouth. So you just fill it up all the way, and you just put it directly and shoot it in the back of your throat, and just wash it down with water. Okay? So this one we are not putting in a cup or a glass. Okay? Very, very important with this formula. So you can check that out. That also has a lot of vitamin D in it as well. So if you're using this formula, this would actually replace your vitamin D. So we do want to emphasize that. Okay? If you already bought vitamin D, you have vitamin D, finish your vitamin D first and then transition to this formula. But there's really 2 things in one. So this is actually derived, most astaxanthin is derived from krill. In fact, in our krill oil that we make, we actually have twice as much astaxanthin as any other astaxanthin on the market. Just wanted to mention that. But this actually, the source on this particular formula comes from algae. Okay? And we're using a very unique patented process on the manufacturing level called supercritical extraction. Supercritical extraction. So, has anybody ever heard of that before, supercritical extraction? Okay. So, when myself and Jamie, when we go to the largest raw material shows in the world, okay, and we see all the latest, greatest nutrients, and we look at all the studies out there, not only do we hear and see in all these nutrients, but we also see on the manufacturing, all the latest, greatest technology on the manufacturing process. And this is the latest, greatest. Okay, this is a very, very complicated process that we're simplifying here. But basically, we're using CO2 to gently extract the ingredient from its natural source, in this case the algae, without any chemicals or solvents or any excessive heat. So there's minimal structural changes to the ingredient. So another way to say this is that this is the purest form of astaxanthin in the world when we use this source. You can't make it any purer. Okay? This is our first endeavor into this technology. I'm sure you will be seeing other supplement companies following suit. But this sets the bar extremely high. Can't make it any purer. Okay? There's no other supplement company in the world that has a liquid form of astaxanthin at this dosage with the 5,000 IUs of D that's in this formula using this process. So everybody always says, what's the difference between you and Walmart, or you and GNC, or you and any other supplement company? It's this type of technology which really separates us, okay, from a lot of other supplement companies. So a lot of people say, oh yeah, I'm buying astaxanthin, I got it off the internet. No, you didn't. You did not get this source. You did not get it this way, okay? So we just want to explain that a little bit to show you the differences on the manufacturing process that we utilize with this. Now, a lot of great studies with astaxanthin, And what we can legitimately make health claims on or say about it are 2 things with astaxanthin. Eye fatigue, okay, and at 5 milligrams of astaxanthin a day for 1 month showed a 54% reduction in eye fatigue. Eye fatigue. So this is a big problem. Eye fatigue is also known by the name of eye glare, because so many people are, for their jobs, they're looking at computers all day long, and then they're looking at TVs and all kinds of this. So over time, this puts a lot of strain on your eyes, which can cause all kinds of symptoms, headaches, and migraines, and dizziness, and blurred vision, and so forth. So in just 1 month, doing 1 serving of this has shown to have a 54% improvement in eye fatigue. Another study that we look at is for depth perception. And again, this is very important for all things, but especially if you're driving, right? Or athletics, trying to hit a baseball going 95 miles per hour, you need depth perception. So this has been shown, astaxanthin, to improve depth perception almost as good, 46% in just 1 month. Astaxanthin, okay? So the technical name for eye glare is asthathenopia, right? That's the medical definition of it. But there's numerous studies that have shown that astaxanthin has been shown to be helpful for this. Okay? Other studies. Oops, skipped ahead there. Okay. In Japan, there's been a lot of research on astaxanthin, so we also listed a couple studies here. This study here said astaxanthin had similar, if not better, anti-inflammatory effects than prednisone. So if you went to an optometrist, right, that's what they would give you for most of these eye issues. Corticosteroid shots. That is prednisone. So astaxanthin has been shown to be just as beneficial as corticosteroid shots, as prednisone for your eyes. And by the way, the longer you're on prednisone and these kind of corticosteroids, it causes an imbalance of yeast overgrowth in your GI tract, which will cause a lot of other symptoms, over 200 symptoms associated with candida. And it's not just a female thing. Males, 1 out of 2 males right now have some form of candida overgrowth. For women, 3 out of 4 females have some form of candida yeast overgrowth. And one of the major reasons why is because of the overabundance of prednisone and corticosteroids. Okay? So if you're getting these kind of things, keep that in mind. Those are the dangerous side effects long term of those issues. Okay? Here's another study saying the same thing. So we see this over and over and over again. Okay? So most doctors have never seen this. So if you went to a doctor and said, yeah, I'm going to go with astaxanthin instead of the prednisone, they're going to be like, what are you talking about, right? What are you talking about? Because medical doctors only know 2 things, medications and surgery. They've never taken a nutritional class in med school, and they've never taken a nutritional class since med school, but they're the first to tear apart nutritional supplements, right? Okay? So right here, these studies that I'm showing you, this is what I would show a medical doctor. And they've never seen these. Why? Because they tell me, Mike, I've never seen these. So you have more education and information than every single optometrist in Western Pennsylvania just with these 2 slides. I'm telling you that right now. Okay? By the way, there's over 25 other published studies for the eyes on astaxanthin. Okay? So it's very, very powerful formula. Okay, any questions on that at all? Yes. Tablet. We do have it with another company, but it's not as pure. It doesn't have the D in it, and it doesn't use that supercritical. So this is a liquid, but it's very clean. It's kind of like there's no sweeteners in it, and it has like a semi-sweet flavor. It's kind of like nondescript. We use safflower oil as a base, so you kind of taste that oil base, but it's not disgusting. Nothing that we have never had anybody say they don't like it at all. But we're 2 servings a day for any major eye issues. Major eye issues. Yes. Not this one, because this is so pure and it's red. The natural source of the algae is red in color, that this will actually stain. This will actually stain. Okay? We also don't want to gargle with it. It's not a mouthwash, or your teeth will turn pink. That's how pure red this is. Okay? That's how pure this is. So, on that. So again, you notice I didn't say anything about cataracts or macular degeneration. because there actually, at this point, there are no published studies on macular degeneration or cataracts. However, I've had numerous doctors that I've worked with that have used astaxanthin, 2 servings a day, and have had incredible results with their patients for cataracts and macular degeneration. We just, right now, there is no double-blind placebo-controlled studies on it. So these are more anecdotal reports. But I can tell you numerous people have had great results with the astaxanthin for these major serious eye issues. Okay? All right. Then, of course, we have some other options here as well. So the Pro Reds. Pro Reds, again, is one of our fruit and vegetable drink formulas. This one has 5 servings of fruit and vegetables in it. Now, of course, we want you to eat your fruit and vegetables, okay? The latest stats are you need 8 to 10 servings a day of fruit and vegetables. And a typical American right now eats 3 servings. And unfortunately, they list ketchup and French fries as 2 of those 3. Okay, so that means 1. The average American right now only eats 1 fruit and vegetable a day. So it's pretty sad. We call it the standard American diet because it's very sad. So the Pro Reds, just like any of the other fruit and vegetables we have reds, oranges, greens, purples back there for you to try if you've never tried this. But this one is your basic one, and there are some additional nutrients in here that are really good for your blood, really good for your heart, and really good for your eyes. And this is one of the things that Dr. Weiner takes every single day, and his eyes actually improved taking Pro Reds. And he talks about that on the radio in there. So again, 5 servings. So this is half your daily dose of fruit and vegetables, and I think it tastes really good as well. Has some antioxidants, just like astaxanthin, but different ones. Zeaxanthin is in this, which is a cousin of astaxanthin in there. Has a little bit of lutein in there as well, so has some extra nutrients that are specifically for the eyes. But again, this is where we're promoting it there. So the eyes, lycopene, lutein, and a form, zeaxanthin, form of astaxanthin. Registered trademark ingredients, again, whenever you see that little R with the circle around it, that has the most published researched form of that ingredient. That's why we're using that. Does that cost more for that ingredient? Yes, it does. Yes, it does. But we're not going to cut any corners where a lot of companies do cut corners when it comes to the ingredients that they're using. So liver, brain, heart, immune, and eyes are all benefits of the Pro Reds. If you have serious eye issues, I would do 2 scoops a day of this. 1 scoop in the morning, 1 scoop in the evening. Can you just do 1 scoop? Yes. Yes, you can. But again, we're trying to be as aggressive as we can nutritionally until we get that condition under control, and then we can start backing down the dose. But that's how we would recommend this. Now, this normally is $45, okay? 30 servings. If you're just doing 1 scoop a day, that's 1 serving, that's a month's supply. If you were to go to the grocery store and buy the amount of fruit and vegetables in this 1 serving, or in this can, it would be over $250 worth of fruit and vegetables that you get for $45. 30% off this week, that's $12, $13 off. So think about that. This counts as a food. This is part of your food bill, not your supplement bill. And that's how you would want to look at the different colors that we carry. So if you've never seen that before, I'm just going to pass that around. We also have in little individual packets as well. If you travel, they're nice and handy. Again, though, they're in the back. If you've never tried them, please try it. Yes?
Should that be taken on an empty stomach, or can you take it with food?
Yeah, it doesn't matter.
Okay.
Yeah. We always will say it if you have to. If you need to take it with food, we usually put it on the directions. If it doesn't, to say anything, that means you can take it with or without food. Yeah, we try to keep that simple for you. So there it is. Yeah, it's actually $2.50 on that. Convenient, you don't have to worry about spoiling, of course, that's another issue as well. And you get a variety. It's over 40 different fruit and vegetables. And most people, they eat about 80% of the same foods weekly. So this gives you a variety of different fruit and vegetables that you normally don't get as well. So that's another added benefit of the different colors there. And then lastly is omegas, omega-3D. So there are several studies that have talked about the benefits of omegas and helping with eyes, in eye health, in macular degeneration, in dry eyes. Okay? Essential fatty acids are very important for the fluid in the eye, helps with eye pressure, known as glaucoma as well. Okay? And most people are eating way too much of the bad fats, the hydrogenated fats, the saturated fats, and this imbalance causes a lot of multitude of problems, which we classify as inflammation, so pain and all kinds of issues. So we know omegas, if we take the right form, omega-3, at high enough dosage, this reverses this imbalance, and it gets into the cellular level, and therefore it helps with all different types of organ systems, not to mention your eyes, but your brain, your heart, your hormones, weight loss, just to name a few. But there's thousands and thousands of benefits and published studies on that. So when you look at fish oil, and here's the bottle for you. We have this in 3 sizes, the 60, 120, 240, and we also have it in liquid as well. Fish oil is broken down into 2 parts. The main points of a fish oil are EPA and DHA. Okay? EPA and DHA. That should be DHA. That should be that's a typo. It's DHA. Okay? EPA is more for pain and overall inflammation. DHA is more for brain and heart. But together, you really should get a blend for all inflammatory issues. And so the research shows you need to be at least 1 gram or 1,000 milligrams a day for prevention, or 2,000 milligrams or 2 grams combined for any type of inflammatory issue, in this case, the eyes. So ours is one of the strongest. If you break it down per pill, that comes to 720 milligrams, guaranteed per pill. So to get to that 2 gram level, you need 3 a day. What most fish oil companies do is they give you a lot of filler and very little EPA DHA. And so the price is going to be much cheaper because they're not giving you the actual important part of the fish. That's the most expensive part, but to get the therapeutic benefit. And most fish oils out there at the grocery store or the chain stores are about 300 milligrams. And ours is almost triple, well it is triple that, 720 milligrams. So if you are using any other fish oil out there, you want to look at the strength of the EPA DHA and make sure you're getting it to how many do you need to take to get to 2,000 milligrams per day. So that's really important point. And then we added 500 IUs of D3 in here as well. So 2 a day for maintenance, 3 a day minimum. You can always do more, but 3 a day minimum for pain and inflammation. In this case, eyes. I would go 3 a day for any eye issue to get the maximum benefit of that. We've also, let's see if we have it here. The other thing that we also say here that we just want to emphasize, that is molecularly distilled and tested for mercury, PCBs, and dioxins. We actually, recently, we spent a lot of money to have this independently tested with one of the leading labs in the company, or in the country. And we tested things that they said that no other supplement company has ever tested for. And by the way, everything came out perfect, by the way. As a matter of fact, but we go over and beyond on the fish oil as far as testing wise, and that's another big issue out there when it comes to fish oil, because again, there's a lot of companies out there that do not go through all the steps. There's actually a six-step process that we go through. Our fish oil is actually manufactured in a pharmaceutical drug license facility, which is the highest level that you can have in the nutritional industry on a manufacturing process as well. So it's as pure as you can get on the fish oil.
What form of that is it? Is it triglyceride form or what's in there?
This is ethyl ester form. This is the ethyl ester.
Triglyceride?
Mm-hmm.
Is that as good or not?
Yes, there are numerous studies out there that said there's no difference between ethyl ester form and triglyceride form. There are some supplement companies out there that claim that triglyceride form is better, but that is not correct. That is their way of trying to put down other companies to build themselves up. But that is actually not true. There's numerous studies. In fact, one of the pioneers in fish oil back in the 70s said that there was no difference. He's written many articles that said there's no difference between ethyl ester form and triglyceride form when it comes to fish oil. Okay? So, this is how it works. Again, gets into the cells, the key with fish oil. So, we want the signaling agents to come into the cell, but if it's being blocked by these bad fats, the hydrogenated fats, the trans fats, okay, it's not able to get into the cell. And it takes about 3 months for it to really get into the cellular level. Okay, so fish oil isn't something that you take like a day or two and that's it. It's something that has to be consistently taking it in order for it to get into the cell. And then the message to all your other cells, it reduces inflammation. So again, if you're going to take it, it's something you need to take every single day on that. Okay, so we also just wanted to have a couple little basic tips here, common sense. Make sure your glasses or contact lens prescriptions is up to date, not for computer use. Some people need glasses to help with contrast, glare, and eye strain when using a computer. Position the computer that your eyes are level and at the top of the monitor. This allows you to look slightly down at the screen. Try to avoid any type of glare on your computer from windows and lights. Use an anti-glare screen if needed. Okay, choose a comfortable supportive chair. Make sure your feet are flat. If your eyes are dry, blink more. Okay, every 20 minutes, rest your eyes looking down, looking 20 feet away for 20 seconds, at least every 2 hours. Get up and try to take a 15-minute break if possible. I know not every job you can do that with, but that is recommended to stand if possible as well, okay, on that. Okay, so just basic tips, basic suggestions. Yes, question?
I was just reading.
Yeah.
I mean, wear sunglasses.
Yeah, if you're outside in the sun, right?
The sun was good for you, like vitamin D.
It is, but if again, it can be the glare on your eyes could cause some type of damage going on there, okay? Obviously, the diet is always important. Basic foundational things, right? Mediterranean style diet is what we recommend. Nothing crazy, nothing exotic. So chicken, turkey, fish, know your sources, organic or wild as much as possible. Back to basics. Again, we mentioned fresh fruit and vegetables. Green leafy vegetables as much as possible. Spinach, kale, and collard greens. With the fish, salmon, tuna are some of your best choices. Again, wild. Eggs, nuts, beans. So, basic stuff. And all this is in the back. We can give you brochures on all this as far as the diet goes. Good fats, all very, very important for you on that. Okay, so again, any of these will be helpful. But if I had cataracts, if I had macular degeneration personally or a family member, I would do all of these things. Starting with the 20/20, the astaxanthin in that priority. 20/20 astaxanthin, pro reds, omegas in that order priority.
How did you say to take the 20/20?
The 2020, if you have any serious eye issues, is 2 droppers full in the morning with a glass of water or tea or juice. Just enough, because it is alcohol based, so enough liquid just to dilute the alcohol. Drink it, and the same thing in the evening. So 2 and 2. Okay? Well, if it's a serious eye issue, right, we're slowing the process down. So yes, this would be something that you would be continuously taking. Yes.
What about for dry eyes? Would you still take morning and evening? Or
Yes, until the dry eyes are improved. Yes, something as minor as that, yes.
There's still a place for Occutane and
Sure, yep, so other companies have other supplements. So Occutane would be like a basic multi for your eyes that Douglas Labs carries here, right? And then if you have more macular degeneration, would be more Macu Shield. Okay, the Occutane is 3 a day, the Macu Shield is 6 a day. And if you have cataracts, Dr. Weiner also recommends L-carnosine by Douglas Labs, 2 a day. So again, there are other options out there as well. These are the options that Dr. Weiner's company has. So we just, yes?
Occutane, what's the difference with Occutane and that?
Occutane is like a multivitamin for your eyes.
Okay.
Yeah, it's basically a multivitamin for your eyes.
This or would compete?
Yes, they would complement. They all work together. They all work together. Now there's other things that we have that we get asked questions about. Eye floaters. Eye floaters. Okay, so does anybody have that issue? Eye floaters? Okay. So for eye floaters, we would do a little bit differently. Okay, we have a different tincture. It's called Circucare Extremities. Circucare Extremities. Again, 2 in the morning, 2 in the evening. Okay.
What causes floaters?
Well, that's really challenge. Everybody's a little bit different on that. There's not one specific answer, right? But we know it can help. Circucare Extremities, 2 in the morning, 2 in the evening, just like the 2020. Rad-free, which are different antioxidants. That's a capsule, 2 in the morning, 2 in the evening. And also Pygnogenol by Douglas Labs, 2 in the morning, 2 in the evening. Those 3 things would be the best things for eye floaters. Okay? And you just have to be consistently taking that. And people who have taken this, their floaters, when they come back to the next time I see them at the wellness event, I ask them how their eyes, they said the floaters are gone. Floaters are gone, okay? For cataracts, as a matter of fact, I was just talking to someone last night who just took the Rad-free for cataracts. 2 in the morning, 2 in the evening, and her cataracts completely gone. Completely gone. Yes. Lutein. So lutein is in some of these ingredients that we talked about. We do, again, there's our companies that do sell it just by itself. That would be another type of antioxidant that strengthens the eyes. So there's, again, a lot of natural things that are out there that can be very helpful. So you can do any combination of these things, and I would just kind of, try it for a month or 2. And then if you're still not seeing improvement, then we need to change it up a little bit till we find the right recipe for your particular situation, okay? But all of these work on different mechanisms within the eye itself, and they all are good for you, okay? Any other questions? Yes? You would not be dosing yourself except if you are taking the vitamin D separately. So that's why I said if you are currently taking the D3 by itself, if you're using the astaxanthin, then we would finish your D or wait till you finish the astaxanthin, whichever you have. We would want to finish the D that you already have and then transition to the astaxanthin. So the astaxanthin is vitamin D plus astaxanthin. So that's where that plus is. So that would be the only way that you would be taking too much D. Okay?
But in any event, could you ever get too much D?
Well, theoretically you can. You can drink too much water, right? So anything theoretically you can take too much of. But That's why we just want to emphasize, if you're taking the astaxanthin, stop taking your regular vitamin D because it's already in that formula. Okay? Any other questions? Yes?
Suggestions for myopia?
Myopia, that would be the astaxanthin. Again, everything we talked about, but the astaxanthin would be at the top of the list. Okay?
What's the maximum amount of vitamin D you can take?
Well, the Vitamin D Council recommends 10,000 IUs, and in current standards now are at minimum 8,000, especially in the wintertime. 8,000 is some of the newest research out there. But we work with some pharmacists and some doctors that even for infants who are coming down with the cold and cough, they actually go up to 20,000 IUs for several days until the cold is knocked out, and then they back it down again. So really anywhere, 10,000 would be where we would feel comfortable with, which is what you're getting with 2 droppers full of the astaxanthin. But anywhere between 10 and 20,000. If you're getting a vitamin D blood test, which we recommend every 3 months if you're doing vitamin D, we don't want to be above 100 on the vitamin D blood test. You want to be between 70 and 100. It's called D325OH-D3 is the name of the vitamin D test.
So this would have 10,000 units.
Mm-hmm.
And then if you were taking the SuperCal Plus, that has.
Teeny tiny amount. If you're doing 4, you're only getting 800 for 4. Yeah, so not enough to make it that much of a difference. Yeah, so you're still plenty good. Okay. Any other questions? Make sense? Okay, folks, thanks so much. My time is up. I did have some extra copies floating around. And again, I'll be in the back if you have any other questions. Thanks. Appreciate it. Have a great day.